This is Successful Aging, Session 8, related to gut health. Welcome, everybody. We are going to explore today how to turn your gut into your longevity sidekick, how to have a healthy gut. This is your gut. It's a lot of guts. It's a lot of important organs in there. It starts with the mouth and ends in the anus, and there's a lot of important stuff in between, including your esophagus, your liver, your gallbladder, stomach, pancreas, small intestine, colon, rectum, and the anus. So it produces a lot of important functions, not just digestion. It also produces antibodies that help defend our body against invaders. Amylase, which helps with digestion. Stomach acid, which does both functions, prevent infections and help with proper absorption of nutrients. There's bile acids that help with absorption, particularly of fats. And the enteric nervous system is a whole brain, if you will, a whole set of neurons that are down in your gut and perform a number of important functions. There's a microbiome in there, which we're going to explore the importance of it. And there's immune cells. About 80% of the immune cells in your body are located in and around your gut. So we want that gut to do a whole bunch of important functions, and we want it to do it flawlessly every time. So we want it to chew and swallow and digest and absorb nutrients. We want it to produce excrement of the byproducts, the things we don't absorb, but also the toxins that our body wants to rid itself of. And it's also a headquarters for your immune system. We don't want it to malfunction in any of those functions. For example, we don't want to choke. We don't want to have reflux. We don't want to have bleeding, clogging, constipation, pain, infections in the gut, inflammation, and we certainly don't want to have cancer. So how can we maintain healthy gut function, avoid the pathologies, and optimize our gut health? Well, I'll introduce you to this book, which is a great overview of those very questions. Fiber Fueled by Dr. Will Bolsewitz, who is a gastroenterologist. An excellent book among many other excellent books in the field. But one of the things we learn as we delve into the science around the gut is that our gut is kind of magical. And in particular, the gut bacteria in the colon are kind of it's kind of like a magical organ that was discovered just in the last 10, 15 years that we didn't even know existed. When I went through medical school, I was taught that the colon is the site where not much happens and we just reabsorb water and turn your bowel movement from diarrhea into a solid thing. But we've subsequently learned, oh my gosh, how wrong we were. There is so many important functions that happen in the gut, in the gut bacteria, in that microbiota, in the colon. Among them, our gut produces these important chemicals that our body needs to be healthy. For example, vitamins, thiamine, folate, biotin, riboflavin, and pantothenic acid. All of these vitamins that you can get in a multivitamin pill, but also the gut bacteria can produce for you. There's neurotransmitters such as serotonin, dopamine, and GABA amino butyric acid, GABA. And then there's short-chain fatty acids. And short-chain fatty acids, we're appreciating, are really like a hormone that your body creates. And your body, but really it's not the body that creates it, it's the microbiota, it's the bacteria in your gut. And these hormones produce a whole host of important functions, including reducing gas and bloating, and reducing irritable bowel syndrome symptoms, helping to regulate the immune system, helping to reduce your risk of cancer, reduce heart disease, strokes, and type 2 diabetes. Short-chain fatty acids. So pretty much fiber in and short-chain fatty acids out of the gut and circulating throughout your body and causing beneficial effects. So what happens when we eat what most Americans eat, which is not fiber and not plant foods, but rather ultra-processed foods? The majority of the American diet is ultra-processed foods like those pictured here. Well, one of the things that we get, and this is really commonplace, is constipation. A lot of people are constipated and don't even realize it because we really should be having one or more soft bowel movements every single day. without the need to strain. And usually when people are constipated, they're having fewer than 3 bowel movements a week. They're passing small amount of hard, dry, or lumpy stool. They have difficulty passing that stool. They have to strain, or they have pain when they pass a stool. They feel like their bowels aren't fully emptying. There's bloating, there's abdominal cramps. So constipation is not comfortable. Another thing that can happen is so-called leaky gut, which basically means the normal barrier in your gut that prevents bacteria and your gut contents from spilling into your bloodstream gets compromised. As we see here, this gut barrier was broken, and as a result, these bacteria can spill into the bloodstream. And guess what happens when bacteria get in your bloodstream? It can be deadly, which is why we think, in part, the immune system is so concentrated around the gut to prevent that spillage. But we think that this leaky gut may contribute to a number of diseases, including autoimmune diseases. The hypothesis is that it's these bacteria that are getting into the bloodstream that are causing our body to react against those bacteria, and then in turn to react against itself. And secondly, there's obesity and type 2 diabetes. So we know it's just not healthy to have that leaky gut. It causes basically inflammation throughout the body. Irritable bowel syndrome is a common malady that people suffer from. It's usually associated with some kind of discomfort when defecating. People can have constipation, they can have diarrhea, they can have painful bloating. So the causes can be a variety of things, including infections, a parasite. Stress can cause, or at least contribute to, irritable bowel syndrome. And then the important one is so-called dysbiosis, or an unhealthy gut bacteria. And then food intolerances can cause an irritable bowel syndrome-like set of symptoms. So what's the solution? Well, it's our beloved unprocessed plant foods. And so some would say there's about 5 food groups, and I'm going to suggest we have maybe 7 food groups of whole plant foods. And these include the intact whole grains, your fruits, your vegetables, your legumes, your nuts and seeds, and then the mushrooms, fungi, which are not really a plant, and then finally herbs and spices. So these would be the 7 kind of categories of foods that you want to really eat every day. And you want to eat as diverse a population of plant foods as you can, because each plant food has its own kind of fiber. The fiber that's in one of these grains is going to be very different than the fiber that's in another one of these grains, or in any of these veggies or the legumes. It's all different kinds of fiber. And each different kind of fiber fuels a different kind of gut bacterium. So as we learn in Fiber Fuel, there's thousands of species of gut bacteria, and we want to promote as diverse a population as we can for optimal gut health and human health. He suggests this approach of F goals, which is a acronym meaning the F is for fruit and fermented foods, the G is for greens and grains, O is omega-3, A is aromatics like onions, leeks, and garlic, the L is our beloved legumes, and then the S is seaweed, sulforaphane, and shrooms, mushrooms. So all these are important to try to remember to get into your diet to fuel a healthy gut. I'll call out my breakfast grain recipe. I like what I call unrecipes, which is very imprecise strategies on ways of making bulk foods that you can keep in the fridge, so you don't have to spend your life doing meal prep, but you can really concentrate a lot of nutrition in one of these batches. So I put actually about 5 cups, well, 6 cups total of mixed grains and seeds. So I have groats in there of oats and rye, buckwheat, millet. I have red quinoa, black sorghum, black lentils, ground flax. These are very antioxidant rich grains that you don't commonly encounter in the grocery store. So I am ordering these things, but you don't have to follow this exact recipe. You can put your whatever grains you like in there, as long as it's about 6 cups, including your ground flax, which you should put liberally into the gamish. as well as your other seeds, chia, hemp, pumpkin seeds. Some of these can be expensive, so focus on what's lower cost, like perhaps chia, if you like to keep the cost down. Wheat germ is a longevity superfood, we think, with its spermidine content. You want to follow it with plenty of water, fill it up to close to the top, pressure cook for about 40 minutes. Importantly, because I find that cooking it a little bit longer, you get a little bit less of the crunchiness, and it's nice and chewy. And then enjoy with berries, soy milk, and it's a good time to put some spices in there like cinnamon and ginger and cloves, perhaps. So my famous red shred is another recipe I like to make, which includes lots of different kinds of fruits and vegetables, including apples, but red beets, which when you microwave or cook them a little bit, you do liberate a little bit more of the antioxidants. Same with carrots. Putting your purple cabbage, cauliflower, ginger root, fennel root, apples, some mix of vegetables that you have in the fridge, shred them up in your food processor, add a little balsamic vinegar, keep it in the fridge, and eat it every single day. The more of those carotenoids you're eating as you eat this wonderful orangish, reddish dish, it's going to give you a golden glow in your skin, that yellowish tinge that you get when you eat a lot of carotenoids. Dr. B also wrote a book called The Fiber Fueled Cookbook, in which it's not just a list of recipes, he also delves pretty deeply into food intolerances. So food intolerances come in different forms. So a lot of people have heard of gluten intolerance or celiac disease, but there's others. And the most common one worldwide is lactose intolerance. The majority of adults worldwide cannot handle lactose. We're really kind of designed as a species to stop eating dairy or breast milk after weaning, but we've developed a cultural habit of continuing to eat the breast milk of another species, oddly, long into our lives. And so the results of that can be some combination, a lot of gastrointestinal upset. I highlighted in blue the gastrointestinal gut symptoms that you can get from food intolerances. So the abdominal pain, bloating, diarrhea, gas, and nausea. And this is one of our most common pieces of recommendation we give patients when they come in with some kind of GI symptoms is step one, stop the dairy, because it's such a common cause. After that, you've got things like so-called FODMAPs, which refer to different kinds of saccharides. So these are basically components mainly of otherwise healthy foods, with the exception of arguably of cheeses and milk. The rest are whole plant foods. So what happens is we get intolerant to some of these over time. You can get a similar set of symptoms as lactose intolerance. That's not to say you can't ever eat these foods again. It merely means that you are intolerant to them at present. The approach we recommend when people, well, we'll get to the approach in a moment. Gluten or wheat intolerance is the famous one, and so gluten-free food products have become commonplace. Celiac disease is about 1% of the population. Gluten or wheat intolerance is another maybe 5 or 6%. You can get a similar set of gastrointestinal symptoms, but you can also get problems beyond the GI tract with headache, fatigues, joint pain, skin rash, depression, anxiety, anemia, inflammation. So it can be unhealthy to be eating wheat. If you have celiac disease, you can never eat wheat or gluten again. You have to stop it for the rest of your life. This is not a temporary thing. You have to be very strict about it. It is important to get diagnosed. If you think you maybe have a little touch of gluten intolerance, and I'll assume I have celiac disease, well, it's best to get diagnosed if you can properly. And oftentimes that includes a bit of blood testing and possibly upper endoscopy and a biopsy to confirm whether you really do have celiac disease or not. Salicylate intolerance can be manifested as an aspirin allergy, but it can also be manifested as inability to consume certain foods like peppers or vegetables, raisins, oranges. even spices and coffee can contain salicylates. Salicylates are kind of present in a lot of foods. Salicylate intolerance can cause additional symptoms beyond the gut and more looking like allergy kind of symptoms. Histamine intolerance is another one of those intolerances that doesn't necessarily mean you can never eat it again, because like salicylates, histamine is kind of in a lot of different kinds of foods. You can't fully avoid it. It's not fully known what percent of people have it, but somewhere from 1 to 6%, maybe roughly as common as gluten or wheat intolerance. It can cause a diffuse set of symptoms, and the strategy to combat this particular problem can be avoid fermented foods, cured meats, dried fruits, citrus, aged cheese, vinegar, beer, and wine. So what is a general approach to food intolerances? Well, here's what we recommend. So first of all is journal. You got to journal your foods, your symptoms, write down what you ate, what symptoms you got. This will help you zero in on what foods are causing a problem for you. And then devise an elimination diet where you cut out all of the culprits. You want to get to a point where you're not having any symptoms at all. So that could take, in some cases, a pretty drastic change to the diet, where for a week or more, you're going to eat a very restrictive diet compared to what you normally eat. It can take from 5 days to 2 to 4 weeks for the symptoms to go away after you've made the appropriate dietary change. Now, once you hit a baseline of, I'm not having any GI symptoms again, now's the time to slowly add some foods back. So if the approach I recommend is if the food that you've eliminated is not optimally healthy, like dairy or aspartame or cured meats, then here's your opportunity to stay off it forever. However, if the food that you've eliminated is something you want to eat, like the case of most unprocessed plant foods, you want to slowly add it back, because in many cases, it's not a matter of you can never eat it again. It's a matter of you need to build back the ability to consume that kind of fiber. Again, if you have celiac disease, you're not going to reintroduce wheat or gluten and get used to it. Your just body can never tolerate it. But other kinds of food intolerances, like the FODMAPs, like the histamine intolerance, potentially you can get to a place over time where your gut bacteria have adjusted and you're going to be able to handle that healthy food. What about flatulence? Everybody says beans are good for my heart, but the more you eat, the more you fart, right? So there is some evidence that reports of gas from eating beans are overblown. So this particular study, they had participants eat a half cup of beans daily for 8 weeks. Only 35% had flatulence in the first week, and only 3% had flatulence at week 8. So you really do get used to it over time. Healthy gut practices. So these are some of the things we recommend you do to maintain a healthy gut. So you want to eat a diversity of plants. It's recommended that you go for 30 or more different kinds of fiber in your diet every week, where we're talking about like a full serving of fiber throughout the week, 30 different kinds of plant foods. And this promotes a healthy microbiota, which we know promotes general good health. So we have pretty good evidence that 30 or more kinds of plants per week is going to equate to lower diseases. We want to start low and go slow anytime we're having trouble and trying to rehabilitate our gut, and have this principle of continuous improvement, increasing our diversity of plants as we go. And this will promote an even more healthy microbiota. Your bowel movements should be large, soft, and fast. Your food should pass through your gut in a pretty short amount of time. Normal transit time would be somewhere between 18 and 36 hours. So you should have about 1 or 2 soft, easy bowel movements a day. And this equates actually to lower rates of certain cancers, and also less heavy metal toxicity and estrogen, because it turns out that our body uses the gut as a sort of a wastebasket. And one of the ways that it discards excess toxins like heavy metals or excess hormones like estrogen or excess cholesterol is it pushes it out into the gut and it expects it to be swept away and go out the other end. But guess what? It's so commonplace in our culture to have a slow gut transit that what happens in reality is our body pushes these toxins into the gut and then we reabsorb them because the bowel movement is moving so slowly. You shouldn't have to strain to make a bowel movement. And one of the problems with straining is things start to bulge out in different places. You can get a hiatal hernia, which can cause lifelong reflux. You can get diverticulosis, which is the bulging in your colon, which can be prone to infection and even death. Like when diverticulosis gets infected, we call it diverticulitis. And it can cause varicose veins in your legs. And the other thing for healthy gut practices I wanted to mention is, interestingly, blood donation. Over a 5-year period, people who donated blood regularly had 50% less visceral cancers, including pancreatic and liver cancer. So there is a strong connection between the gut health and preventing cancer. So one of the things about blood donation is you're reducing the iron in your body. And we think that iron is a pretty powerful promoter of cancer, especially GI cancers. So when we can remove the iron from our body through either blood donation and or reducing the heme iron in our diet, we can reduce our rates of esophageal cancer, stomach cancer, colon cancer quite significantly. Certain spices, antioxidants like turmeric, associated with less colon cancer and other cancers. Beans, intact whole grains, fiber, and phytates. So the fiber and the phytates in the diet have been associated with fewer colon polyps, precancerous colon polyps, and less other cancers in the body. Berries, berries in the diet reduce precancerous polyps also. And there's also interesting research around chicken. Every 50 grams per day of chicken consumption is associated with a 72% increase in the risk of pancreatic cancer. Believe it or not. So your assignment for this next month is identify and fix your own food intolerances if you have them. And remember these 6 steps that we recommend you follow. Step 1 is figure out what it is by journaling. Devise your elimination diet. Get your gut to a healthy place where you're not having these symptoms of bloating and discomfort and other symptoms. And then if it's appropriate, start to add that food back slowly over time. And just like working out your muscles over time, you're going to get stronger muscles. Working out your gut over time with more different kinds of fiber, you're going to get a stronger microbiome. So I do recommend you double your fiber intake. Most Americans eat about 15 grams a day. The recommendation is from 25 to 35 or so. But really, when people are eating more than 50 grams, 60, 80, 100 grams of fiber, you get less and less disease. So you really can't overdo it with fiber. Try to eat the variety of 30 or more different kinds of fiber at least. Remember to schedule your regular blood donation. It's a win for your community, a win for your own health, and try to emphasize these F goals. Try to emphasize some of these superfoods for the gut, like the fruit, the fermented foods, the aromatics. Get your daily onions and garlic. Crush the garlic and then wait 10 minutes before cooking so you form all that wonderful allicin, the anti-cancerous antioxidant in there. Don't forget your legumes. And try to work some shrooms, seaweed, and sulforaphane coming from your wonderful cruciferous vegetables. So I would love to hear from you, your results. Feel free to shoot me an email. And I thank you for your attention. I wish you the best, and I wish you a happy and healthy gut.